I'm joined by Autumn Heaster, Senior Enterprise Director for Patient Financial Engagement at WVU Medicine. Autumn is joining our upcoming Patient Financial Services meeting taking place November 14th as a panelist on a session related to transparency, the No Surprises Act, and patient estimates, and the impact that this is having on patient engagement and satisfaction. Autumn, thanks so much for joining us today. To get started, could you share with us a little bit about your background, how you got your start in the healthcare industry, and your career journey thus far?
Thank you so much for having me, Kate. For me, from the background perspective, I actually started on the clinical side, which is a little different than some people's journeys. Kind of went with that route for a little while, really enjoyed it, but I found that that really wasn't my calling ultimately. Ended up just kind of tripping and stumbling into the patient financial engagement side, honestly, and into the management side. Found that I really have a passion for it and a calling for it, and I'm really enjoying it. And I love that I'm able to use the skills that I do have to help others and make a difference in our communities. So that's really been a huge impact. I've been doing this now for over 15 years, and I just couldn't imagine doing anything else.
That's really wonderful to hear. You're currently Senior Enterprise Director for Patient Financial Engagement at WVU Medicine. Tell us a little bit about what some of your current priorities are for yourself and your team, kind of looking out towards the end of this year and into the new year.
Yeah, absolutely. So for our teams, we encompass lots of different areas. So I think the biggest focus that we have as a team as a whole really is around our patients and that journey that they're on and all those points that we intersect with them and all the times that we touch them in their lives. From a financial aspect, how do we make that journey more pleasant, more realistic, more understandable, and more attainable for the patient? So a lot of the initiatives that we've done for this year and for the next few years actually will be focused around those types of efforts to make sure that it's fully transparent for our patients and that they really have a great understanding and know that we're here to help them and that we're their partners.
I think that partnering with patients is such a common theme for many organizations, and we're looking forward to having you join the panel on financial collaboration and how estimates and transparency is really shifting that conversation and increasing patient satisfaction. Is there one area that you're looking forward to either benchmarking with the panelists or the peers, or looking forward to discussing during that upcoming panel?
I think one of the things that I'm really interested in, really all of them actually, but one of the things that I'm really interested to learn is one of the nuances that I've found as we talk about patient financial engagement is the differences that looks like in every state. So every place that you are, it looks a little bit different, and how you have to interact with your patients might be different, and the resources available to patients might be different. So they may need to take new approaches. So I'm really interested to continue to learn from some of my peers about how they're handling those changes and those nuances and making sure that outreach is getting to the right people at the right time to make sure patients are fully engaged.
I think that's a terrific perspective, and I think a lot of our attendees and the panelists really enjoy hearing from others across the country on what they're doing and being able to benchmark and get ideas as well for what others are doing. So thank you again for coming on today and sharing a little bit about your background with us, and we look forward to having you join us in November.
Thank you so much for having me, and I look forward to it as well.
Thank you.